the second Trump administration will also be filled with dedicated patriots who are eager to make this country the very best possible version of itself. And that includes lifelong progressive Robert F. Kennedy Jr., who was a major proponent of making America healthy again. And the first step to doing so is openly admitting that our nation has a widespread epidemic of declining health, both physically and mentally. This is our chance to finally right the ship and turn things around, and RFK Jr. could be the man for the job, especially since he's been discussing this issue for many, many years. In fact, here's a snippet of him discussing the problem from one of his recent ads.
We have the highest disease rate, and we buy more drugs, and they're more expensive than anywhere in the world. And don't you want a president who is going to fix this country?
Joining us now to discuss is Dr. Peter McCullough, the Chief Scientific Officer for the Wellness Company. Dr. McCullough, thank you very much for being here. I appreciate it.
Thank you.
So now that President Trump has won, I'd like to ask you, what are some of the things that a new Trump administration could do to break the power of the biopharmaceutical industrial complex?
What's looming over America right now has been 4 years of the COVID-19 vaccine debacle. And we are two major organizations, World Council for Health and the Association of American Physicians and Surgeons, that have said that, the COVID-19 pandemic is essentially over. No one's taking these vaccines anymore. Sadly, they're still on the childhood vaccine schedule. So there are calls to remove all the COVID-19 vaccines from the market, and I think it's long overdue. We need to remove the liability protections for vaccine manufacturers so they can stand behind their products. Americans deserve safe vaccine products. We need to have termination agreements with our public health officials so they have restricted covenants, so they just can't go to big pharma and then just turn around and curry favor back to the companies they finish regulating. This and so much more, I think, will be on the agenda for MAHA, Team Trump, and Make America Healthy Again.
Yes, absolutely. It's something I think a lot of us are really looking forward to, is getting America's health crises under control. I'd like to ask you as well about RFK, because he's someone who's been talking about a lot of these issues, including vaccines and their efficacy and their side effects for many, many years now, along with you. So do you think that RFK Jr. would have a positive impact on the incoming Trump administration?
He will. He has an opportunity now. It's very important to get back to normal leadership style. Instead of Anthony Fauci, dictating things to America, what we ought to see is the issues framed, and RFK and the people in healthcare leadership can do this, frame the issues, bring together the stakeholders, work with them, identify a consensus, and then ultimately make solid policy decisions. This has to happen for the vaccines, for liability. Kennedy has made mention of, and I think the entire medical community would welcome ridding America of trans fats, these dangerous seed oils that are chemically modified, like partially hydrogenated soybean oil. The American Heart Association has had a position statement to get this out of the American food supply since 2009. The FDA has been plodding along slowly. That's low-hanging fruit. Kennedy's mentioned improving the safety of the water supply. And the water supply has concerns, everything from aluminum, other trace metals, fluoride. And so we need to have a comprehensive review on what should be done with the water supply. And then lastly, on the use of pharmaceuticals, we have a situation where so many medications are prescribed. Patients are coming to doctors really pushing for this. I think a shift towards health first and non-pharmaceutical products, and that's what we're doing at the Wellness Company, that shift is long overdue.
Yeah, absolutely. One thing I'd like to ask you about as well, because it looks like the status quo is really starting to face a lot of challenges here, and Americans are really ready for it. I'd like to ask you, some people, I'm not sure how they're taking it. It doesn't seem like the people who lost this election are really interested in seeing all of these big changes being made, but a lot of Americans are ready. So I think that's very interesting in and of itself. But also, some people are worrying about civil unrest and some chaos breaking out between now and Inauguration Day in January. I mean, what do you think about that? Should Americans be worried or concerned, or maybe not so much?
No, I don't see it. I've really been happy with the tenor and the tone set by both sides here. There will be a peaceful transition of power. You can see how Trump is very carefully navigating. He's actually making these assignments before Inauguration Day so people can get settled in on the decisions that he's making. And look who he's picking. He's picking very senior, very experienced people. I think the second Trump administration will be very different than the first.
Absolutely. I think one thing he's learned since 2016 and 2020 is that personnel is policy. Absolutely. So I really love to see that. I'd like to ask you as well about another part of healthcare that's being sort of overlooked a little bit. So when it comes to the growing parallel healthcare system, do you think that's something that will thrive and grow under President Trump?
It will. Wellness Company is absolutely skyrocketed in terms of its prominence and its delivery of healthcare, not only to the United States, but to the world. It's an alternative through forms of membership that provide, free prescription medications, free supplements, access to telemedicine. It's a wonderful supplemental to people's traditional insurance, or they're going with more affordable health sharing for those who are younger and healthier. And I think it's a must for people with no health insurance whatsoever. The Wellness Company is going to feature things that will save dramatically, including emergency kits. The emergency kits are pre-prescribed, and they allow somebody to avoid expensive urgent care or emergency room visits and handle simple problems with a guidebook and under supervision and telemedicine. And this has now become so popular. People are making the choice of the Wellness Company, and boy, are they saving.
Wow, I just love that. I have a lot of questions about this emergency medical kit. One of them including about to sort of zoom out here and look at the actual manufacturing and making of a lot of medications. So there is some concern in this election about the fact that a lot of our medications are made abroad, right? So when it comes to supply chain issues, and we saw it certainly during COVID with, relying on foreign countries to produce medicines that we need, and even things that weren't necessarily medicines, but other things like baby formula. So this was really a big problem, and there's been a lot of debate. And I'd like to ask you, Dr. McCullough, about this. I mean, do you think that the incoming administration should take a close look at how we could possibly regain some of those supply chains abroad that are responsible for making these prescriptions?
That's a very good analysis. One could look at the supply chain for pharmaceuticals as a national security issue. And as Rosemary Gibson put in the book China RX, China controls the original ingredients in almost all the drugs if they're made in China or India. Wellness Company, we have our pharmacy that puts together the kits in Florida, so we procure the medications. Then we have our prescription pharmacy in Ohio. So those are U.S. based. But if the Trump administration had an initiative through HHS and the Department of Commerce to actually have primary American sourcing of the original ingredients, we'd be far safer as a country.
I certainly agree. It seems like such a basic thing to think about, right? I mean, like you just said, this isn't even really a big economic issue. It's just basic national security here. So it's health and security all in one. So I think that's such a no-brainer. I'd like to ask you now then more about your emergency medical kit, because it seems so important to me. I've been doing a lot of homework and research into it. I'd just like to ask you, what comes in it? What do people need to know about it? Where can they find it? Let's go down through the list there.
Well, there's now 5 kits. So we have the light blue kit that you're showing there. This is the one for home. Again, prescribed per individual, covers bronchitis, bladder infections, fungal infections, cellulitis, skin infections, nausea, vomiting. There's the forest green travel kit that's really appropriately designed for a cruise boat and people on the plane. We have the red emergency kit. That's for camping. That would have been helpful in these terrible floods and hurricanes that we've seen recently. And then we have the black contagion kit. That's the one that handles bird flu and acute COVID-19. That should be actually in every farm out there keeping chickens and birds right now per individual employee. And then we have the child pediatric kits that allow the parents now to handle common ear infections, throat infections, bee stings. It can come with or without an EpiPen that's affordable. These kits have liberated families from having to go to the urgent care or emergency room for simple things that can be handled at home.
I love that so much. I'd like to ask you, because this seems just so comprehensive and so needed, right? I mean, the market for this has just got to be huge. I mean, I personally am very, very interested in this. So what was the initial inspiration for you to sort of build these kits?
Initially, we saw patients with acute COVID-19. They were being denied antibiotics and denied other drugs at the pharmacy. We said we can never have this again. It is possible to pre-prescribe medications in people's name, have them long-lasting on the shelf, put them in dry kits that float in water. It can be, in an emergency, can be life-saving. And then people can actually, through a guidebook and then help over telemedicine, manage themselves. And people want that freedom. And I can tell you, compared to the cost of going to urgent care or ER, These are very cost effective and give people a peace of mind.
Wow. So rapid response, cost effective. I imagine you're hearing a lot of good feedback about this so far. I'd like to ask though, I mean, what kind of things are you hearing from people?
Oh, lifesaver. We've seen people say, listen, their lives were saved on this. We've seen testimonials. Remember during the hurricanes, Helene and Milton, people were stranded for days. Can you imagine that? Having a deep tissue wound, can't get to an ER urgent care, the infection is setting in. One needs to be able to clean the wound, start antibiotics, and get going right away with the kit. There's other people who developed, aspiration, pneumonias, other things. They were all saved by the emergency medical kits.
Wow, absolutely. And of course, one last thing I'd like to ask. I mean, it sounds like you could basically bring this kit with you just about anywhere, at home, on the road. Is that about right?
Yeah, I travel with one now, and we've already had a situation where somebody in my party got really sick. And if we didn't have one of these kits, we could have not made it through the night and we would have been in the emergency room. And this has happened to people when they travel. That's the reason why I should bring the kit.
Absolutely. I was just going to ask because my brother actually just got engaged on a vacation to Europe, and he and his fiance, they got really, really sick, horrible food poisoning. And I was just looking at the homework for this and looking online saying, gosh, I need to get one of these as soon as physically possible because my own family is already showing the use case for it. So this is just really, really interesting. And I'd like to ask you, if you have any other final thoughts or information you'd like to share with our audience, I would love to hear it, Dr. McCullough.
One of the breakthroughs we've had at the wellness company is what's called spike support. We've now improved the product. It's called the Ultimate Spike Detoxification. It's based on the peer-reviewed publication of McCullough protocol-based spike protein detoxification. This is for patients who've had COVID or have taken the vaccine. They've accumulated SARS-CoV-2 spike protein in the body. They have chronic illness. This is our best chance of clearing the spike protein and getting on the pathway to better health. So look for Ultimate Spike Detox. It's just out on the website and available for purchase.
I love to hear that. And of course, Dr. McCullough, thank you for your wisdom, your insights, your time today, and all of the things that you're doing. We really appreciate it.